My name is Professor Marion Eckert and I'm the Director of the Rosemary Bryant AO Research Centre and Professor of Cancer Nursing here in South Australia, the first Professor of Cancer Nursing in South Australia. I would like to present to you today a bit of an overview and background to the project and the work that we've been doing. But first I just want to tell you a little bit about my professional background. I've been a nurse for many years and have worked across many different sectors, public, private, tertiary, overseas, in executive roles and in clinical roles. I found that the most rewarding role has been where I've been able to influence change when it's related to improving quality care. In regards to the innovation, we were fortunate enough to receive a grant which was focused on building nurses' roles in regards to primary care as it relates to doing skin checks. One of the things that we recognise and we do know is that skin cancer is Australia's cancer. 2 out of 3 people by the time they are 70 years old will have some form of skin cancer. And in Australia, there is approximately 600 dermatologists across the country. It's a huge gap. We also know that GPs, general practitioners, are extremely busy. And so this is where we feel that nurses can play a pivotal role in this field, particularly in primary care and particularly in rural and regional Australia. What has been unique to this project is also that we've worked with a company to be able to supply artificial intelligence. So what that means is we've been able to work with the nurses and train the nurses while we're doing the clinical placement, and as part of the training, we've been able to turn on the industrial AI, the artificial intelligence. And what we've been able to do with the artificial intelligence is we've been able to use that as a service or a decision support, which has actually enabled those nurses who may be in those rural and remote areas to have another set of eyes that can look at what these lesions are. It's been an incredible opportunity for these nurses. So many of the nurses have reported that they feel so empowered. They've actually improved the work that they've been doing for their community by providing this further preventative health strategy. Further to this, we're excited to say that we've now progressed this research into more marginal groups, and now we're working with prison health services across South Australia to improve the primary prevention in prison health services. It's a huge initiative and something we're really excited to see, and we're actually now scaling it across different areas. We've now moved into the mining industry where there's a lot of nurse practitioners who are also keen to do this, and I'm really excited to be working with an amazing team because this can't be done by one person. It does take a team and everyone plays their part. I'm really proud to be a nurse and to know that we're making a difference to the community. To nurses who see ways of delivering better models of care is to really challenge the status quo. Make sure you have really good evidence to know what you're doing is really worthwhile and valued. We found incredible engagement with GPs when we've approached them and really worked with them to say, how do we build and support your workforce so you can improve the health of the community. It's making a real difference, and I know that we are saving lives. So why wouldn't you do this, and why wouldn't you keep challenging the status quo? And so I think any nurses out there who are thinking about doing this, when you know that you've got the right evidence, you've got to keep going. Thank you very much.